Kathryn MacDonald. I'm the Communities Engagement Director at community music and education charity More Music. I would like to tell you about our health and wellbeing project, the Seagull and the Chameleon, which focuses on singing. There is, of course, as we all know, much evidence to demonstrate that singing has positive impacts on mental and physical health. Social prescribing is developing as an alternative to a medical or a pharmaceutical intervention. It is a growing movement that connects people with a range of non-clinical programs, services and activities in their local community, like walking groups, mental health counselling, fitness, mindfulness sessions, gardening and singing. More Music has 27 years of experience working with people in diverse communities and neighbourhoods, using the creative arts, particularly music, to build confidence and spirit. We have a lovely, beautiful, well-resourced building and a staff of 15 people. We're based in the beautiful seaside town of Morecambe on the northwest coast of England. It's a town that scores high on the indices of poor health and multiple deprivation, where there is multi-occupancy housing, extensive use of food banks. A local head teacher describes the town as facing a rising tide of poverty. Bay Medical Group is a partnership of medical practices that joined together in 2016 because of overwhelming pressure and the difficulty in recruiting doctors to work in our community. There are unmanageable numbers of patients, people wait weeks for appointments, and there is an over-representation of chronic conditions. Our other partner is the Children and Adolescent Mental Health Service. It is also under extreme pressure. There are long waiting lists for children and young people who are experiencing significant levels of anxiety and self-harm. The interventions they're able to offer are short. Spirit of 2012 have funded this pilot project as part of their mission to develop a programme inspired by a new sense of an inclusive community that grew after the UK Olympics. And their strapline is investing in happiness, something I think we can all buy into. The Young People's Singing for Health project is called Chameleon, and the name was chosen by the participants because they see that the chameleon is a resilient beast and survives by being adaptable. Chameleon works with young people referred by the CAMHS service, and sometimes participants invite their friends who they think would benefit. The young people like the group because it is small and participants come from different places, so the relationships are new. Successful outcomes are all related to the progress of individuals who gain confidence, musical skills and new friendships. It's a very, very safe space. A very courageous teenager who took the bold step to perform solo at a young people's gig told us that the breathing and vocal techniques she had learnt in sessions, plus the support of her peers, were among the tools and resources that she could call upon that enabled her to take this momentous step and to succeed. The second group, the Seagull Café, is an afternoon of group singing, individual performances, friendship building, dancing, tea and cakes. It's led by 2 musicians who play and sing, and the Bay Medical Group care coordinators refer patients who attend the surgery whose main issues are isolation and loneliness. The singing, the movement and the laughter support their physical health, their moods and their well-being. We can see their confidence and the relationships blossom week by week in this very safe space. Here are some things that people say. It's Dad's favourite day. Tuesday is now our Dad's favourite day. The difference it makes to our lives cannot be counted as it's so big. I never stood up to sing solo before. I just felt I could have a go. And Eric said, I have not picked up my harmonica for 10 years since my wife passed away. So many tunes are coming back to me now. Research is a significant aspect of all Spirit of 2012 funded projects, and they use the evidence we provide to influence and change government policy. We have adopted the Office of National Statistics Wellbeing Measures as required by them. More Music has an established relationship with the International Centre for Community Music, and we're continuing to work with Ruth Curry, who has just completed a doctorate on our work. Her supervisor here is Dr Stephen Clift, a visiting fellow ICCM and a leading expert on the impact of singing on health. The questions that have emerged from our research are about the democracy of the experiences, the pedagogical approaches, the shared values, and the way the evidence can be utilised to increase understanding of the role of singing projects in arts and health partnerships. The success of this pilot and the research have resulted in an extended impact award from Spirit of 2012, enabling us to continue to develop the work over the next 2 years. This continued support will facilitate our relationship building with the medical profession and convince the doctors and the clinicians to fund it in the long term. COVID-19, of course, has changed everything. No longer able to meet in person, we have sought alternative ways to maintain relationships and our connections with our participants. Knowing that many of our elders don't have digital access, we have designed and delivered newsletters, and we have created films of our musicians for those that can get online. We have a programme of musical visits to play outside care homes and to individuals in their backyards and on their doorsteps. However, for the young people who experience anxiety, online activity is not for them. It's not appropriate, and so we've been phoning them up and chatting and planning to get them together as soon as we safely can. This break in activity has really demonstrated the physical and mental benefits we know the project brings. It has so obviously become the highlight of so many people's weeks, and we look forward to when we can resume and gather our people together again.